Hi, I'm Dr. David Hess, and I'm a primary care physician in West Virginia, and have been practicing medicine now for nearly 20 years, seeing tens of thousands of adults and children in my career. My patients sometimes ask me if the COVID vaccines are safe. My answer is yes. COVID vaccines are safe. They were first evaluated in tens of thousands of people who volunteered to participate in clinical trials. These clinical trials followed the same thorough safety and efficacy standards that the FDA sets for all vaccines in the United States. Since then, millions of people in the United States and around the world have received COVID-19 vaccines, and the results from the U.S. and global safety monitoring efforts are excellent. There are rigorous systems in place to quickly identify any safety concerns and take action. These monitoring systems provide information that allows public health and medical experts to update the recommendations and guidelines as needed to ensure COVID-19 vaccination is safe. When it comes down to it, COVID-19 vaccines are safe and effective. Vaccinations save lives. That's why I chose to be vaccinated and why I recommend COVID-19 vaccination to my patients and my family. Thanks for tuning in. I'm Dr. David Hess. For more information about COVID-19 vaccines or to find a location near you, visit Vaccinate.wv.gov.
Hi, I'm Dr. Catherine Moffat. I'm a physician specializing in pediatric infectious diseases at West Virginia University. My patients and their caregivers sometimes ask me if children and adolescents can have side effects from COVID-19 vaccination. There can be side effects, although not everyone has them. The side effects that children 12 and up can experience are similar to those in adults. These tend to be mild to moderate and include soreness, redness, and swelling around the injection site, tiredness, headache, chills, fever, or nausea. These effects usually last only a few days, and kids may experience some or none of them. These side effects can be a sign that the immune system is building up its natural defenses against COVID-19, but many people build protection without these signs. Similar to adults, these effects are more common after the second dose, yet that second dose is essential for maximum protection. Although these side effects can occur, they are short-lived and outweighed by the benefits of being protected through vaccination. Many cases of COVID-19 among children and teens are mild, but even mild cases in children can lead to long-term health problems. I've cared for children with COVID-19. Some of their cases can be quite severe. In fact, COVID-19 was among the 10 most common causes of death in children in 2020. And COVID-19 hospitalization rates among teens increased in the spring of 2021. COVID-19 vaccination is a safe and effective way to protect our kids against the virus. It protects not only the person who's vaccinated, but those around them as well, especially children who cannot yet get vaccinated. This is why I recommend that my patients ages 12 and older get vaccinated, and I encourage patients, parents, and caregivers to discuss COVID-19 vaccination with a healthcare provider. Thanks for tuning in. I'm Dr. Catherine Moffat. For more information about COVID-19 vaccines or to find a location near you, visit Vaccinate.wv.gov.
Hello, everyone. It's Tuesday, October the 26th. Regretfully, since the last time we had our last briefing, which was last Friday, we've lost another 53 West Virginians. It is an astronomical number when you think about it, 53, but 4,316 deaths. But nevertheless, our numbers in lots of ways are surely showing improvement, but we knew once we were here in this surge that we would not be able to really move the needle a whole lot in saving people's lives, so because we were already in a spin cycle. 53 deaths. The 4,264th death is a 61-year-old female from Cabell County. The 4,265th death is a 70-year-old female from Hardy County. The 4,266th death is a 59-year-old male from Nicholas County. The 4,267th death is a 51-year-old male from Harrison County. The 4,268th death, a 92-year-old male from Ritchie County. The 4,269th death, a 63-year-old male from Kanawha County. The 4,270th death, a 40-year-old male from Logan County. The 4,271st death is a 76-year-old female from Berkeley County. The 4,272nd death, a 59-year-old female from Harrison County. The 4,273rd death, a 68-year-old female from Wood County. The 4,274th death, a 47-year-old male from Greenbrier County. The 4,275th death, a 56-year-old male from Berkeley County. The 4,276th death, an 84-year-old male from Tucker County. The 4,277th death, an 82-year-old female from Fayette County. The 4,278th death, an 87-year-old male from Raleigh County. The 4,279th death, a 75-year-old male from Wood County. The 4,280th death, a 76-year-old male from Putnam County. The 4,281st death, a 58-year-old male from Wyoming County. The 4,282nd death, a 58-year-old male from Nicholas County. The 4,283rd death, a 70-year-old female from Putnam County. The 4,284th death, a 59-year-old male from Gilmer County. The 4,285th death is a 60-year-old female from Roane County. The 4,286th death is a 71-year-old male from Ohio County. The 4,287th death, another 45-year-old female from Hancock County. The 4,288th death, a 91-year-old male from Harrison County. The 4,289th death, a 54-year-old male from Lewis County. The 4,290th death, a 59-year-old female from Mason County. The 4,291st death, an 88-year-old male from Hampshire County. The 4,292nd death, a 60-year-old female from Kanawha County. The 4,293rd death is a 79-year-old male from Raleigh County. The 4,294th death, a 48-year-old male from Cabell County. The 4,295th death, a 48-year-old female from Kanawha County. The 4,296th death, a 66-year-old male from Mineral County. The 4,297th death, a 44-year-old female from Kanawha County. The 4,298th death, a 64-year-old female from Lincoln County. The 4,299th death, a 57-year-old female from Kanawha County. The 4,300th death in West Virginia is a 64-year-old male from Kanawha County. The 4,301st death is a 69-year-old female from Kanawha County. The 4,302nd death is an 83-year-old female from Jefferson County. There's 14 deaths on reconciliation now with the DHHR that range back to September through October. The 4,303rd death is a 62-year-old male from Harrison County. The 4,304th death is a 90-year-old male from Wayne County. The 4,305th death, another 43-year-old female from Lewis County. The 4,306th death, a 32-year-old female from Wayne County. The 4,307th death, an 87-year-old female from Nicholas County. The 4,308th death, an 86-year-old female from Raleigh County. The 4,309th death, a 64-year-old male from Wyoming County. The 4,310th death, a 61-year-old female from Monongalia County. The 4,311th death, an 82-year-old male from Monongalia County. The 4,312th death is a 59-year-old male from Wood County. The 4,313th death, another 40-year-old, 46-year-old female. The 4,313th death is a 46-year-old male from Brooke County. The 4,314th death is a 58-year-old male from Kanawha County. The 4,315th death is a 64-year-old male from Cabell County. And the 4,316th death in West Virginia is a 60-year-old female from Wetzel County. Just before I go through these numbers, Mark Curtis asked this question. We've got it now, and maybe let's go to this chart real quick. But, have you got that, Jordan? Mark, if you look at this, in 2020, the average age of death was 77 years old. In January, it was 77, and then it started declining. February 76, March 74, April 71, May almost flat 71, May was 72, June was 72. And then we had a bump up there a little bit in July. We went back up to 75. Then we were back down to 71 in August. But September and October, we've fallen all the way to 69 and 67. And if you think about the average of all these ages to come from 77 as an average in 2020 down to 67 in the month of October, so far in October, it's a big difference. It's a great, great, great big difference. It doesn't sound like much, but when you go to averaging all the ages, it's an awful lot. It's an awful lot. We have 7,366 active cases in West Virginia right now. That's down from almost 30,000. We have 714 new positive cases that have come back in the last 24 hours, and our daily positivity rate is at 7.01. Our cumulative positivity rate is at 6.09. We have 256,430 people that have recovered. We have 637 that are hospitalized. It still falls and keeps on falling. We have 202 in the ICU units and 126 that are on ventilators. We've got 5 green counties. We've got 42 outbreaks in our schools in 19 counties, 563 confirmed cases, and 53 of our counties, have a mask mandate. Now, I want to go back to one thing here just real quickly. and that is on our booster shots. You know, we started out with the only booster shot that you could get was Pfizer, and that's changed now to Moderna and J&J or Johnson & Johnson are now, you know, out there for booster shots. If you have not had your booster shot, you need to get it. Now, we've got a lot of people that are responding to that, but it is easy to see. You know, the numbers won't lie. The number of hospitalizations that we have now, you know, are still predominantly those that are unvaccinated. But as it was before, remember when it was 94% or 97 or 99% of those that were hospitalized were unvaccinated. And then all of a sudden we awakened to the fact that it was down in the 80s. And the reason for that is we had the vaccine basically that you had gotten 6 months, 8 months ago, really and truly they were wearing off and wearing down, and your actual, you know, percentage of prevention was way, way, way down. And so we told you this, and we urged the CDC to let us get boosters in the arms of our folks. And we really just got stonewalled over and over and over. Remember, they targeted, I think, September the 20th. And we started early on asking for booster shots, really begging the federal government to move because we were the first in the nation in getting the vaccines in people's arms. And people needed those booster shots. Well, now the number of hospitalized has now dropped from the unvaccinated now that are in the hospital are 76%. You know, the number of folks that are in the hospital today are 76% unvaccinated. What does that tell us? I mean, it tells us really easy that there's 24% of those people that are hospitalized that are fully vaccinated, but they may not have their booster shot, you know, or maybe they were late in getting their booster shot. But whatever it may be, absolutely, it tells us mathematically clear as it can possibly tell us that if you are eligible and you are right now to get your booster shot and you don't get it, you're making a real mistake, a real mistake. The numbers tell us wholeheartedly that the number of vaccinated people in the hospitals are going up. What is that from? It's from just the vaccine wearing off, and you need your booster shot. You got to listen to me. You know, absolutely, without any doubt, the numbers are telling us this loud and clear. The numbers are also telling us loud and clear that the age difference is significant, and people that are younger are dying. People that are younger are dying with this dreaded pandemic, this dreaded disease. You've got to get your booster shot. And younger people, from the standpoint of our parents and everything, please encourage your children to get their vaccinations, because I keep telling you this over and over, it's going to get cold. And when it gets cold, this thing could very well get really bad. And it could really get bad with our children. So please help me get them vaccinated as well. Okay, just reminders real quick, 65 and older, you get any symptom whatsoever, the testing's available to you and it's free. The antibodies can save your life. For those people that are compromised, 65 and older, with any kind of health condition, and you go into a crowd of people and everything, we highly encourage you to wear a mask. You know, I've been through the stuff on Moderna and J&J and told you, that the boosters are available for them. On Moderna, it's for people 65 and above that are 6 months out, and J&J is for everyone 18 and above they're 2 months out. You know, all the stuff, they're not recommending mixing things like you had Pfizer and now you're going to get a booster in Moderna. Dr. Marshall will tell us more about that in just a second. You know, as far as the booster shots, like I said over and over, are available right now. If you've lost your card, we'll get you a new one. And I'm being told something here that am I reading this incorrectly? Hold on. Well, Dr. Marshall will go through the mixing of the brands, you know, and everything with you. The CDC, I'm showing, has made recommendations now. I'm sorry, I'm reading it incorrectly. The CDC is recommending now that the mixing is okay. And we've thought that all along. I thought Dr. Marshall would come on and explain that, but nevertheless, it's great that they're now recommending that we can mix, and that's good. There's 66.6% of our people 12 and above that have received at least the first shot, 82.3% that have received the first shot that are 50 and above, and 92.7% of our elderly 65 and above that have received the first shot. Vaccine eligibility is 12 and above right now. They're really contemplating going all the way down to 5. We'll see, you know, when that comes out, we'll be ready. From the standpoint of our young people, I encourage and I ask our grandfamilies the same. You know, grandfamilies can take advantage of this school voucher, but absolutely, I keep telling everyone it's going to get cold. It's going to absolutely get cold. And so for our children, for their sake, absolutely, I would encourage in every way to get them vaccinated. The COVID-19 vaccine info line is all up there. The free testing I tell you about all the time. I always thank Fruth and Walgreens for all the great work that they did and continue to do. Our long-term care facilities, we've got 42 outbreaks in our long-term care facilities right now. We have 1 outbreak in our church community, and that's in Nicholas County. And we have 122 inmates with this now at 14 facilities, and 38 staff members at 17 facilities. I remind you all the time, you know, to go get your flu shot. You know, it's available to you, and you can get it at the same time you get your COVID vaccine as well. I've told you over and over about this rental assistance program and everything. It's a great program. There's lots of dollars still available to go out to West Virginians. You know, if you're a renter or if you're a landlord and people haven't paid you as a landlord, I highly recommend you get in touch with us, and we may very well be able to backfill some dollars there to you. If you're a renter and you've come upon really financial hard times and everything, we may very well be able to backfill and get some dollars to you as well. There's no point, I don't think, in going back through, you know, the bill that we passed and I sent up in regard to, you know, terminating people and everything, that they needed some level of exemption, and that was for, you know, medical reasons or religious reasons, and I think that's just following the Constitution, and that'll go into effect on January 1st, 2022, and so I've told you about all that. Last thing I've got to report is tomorrow, well, the fall trout stockings are now underway, and the stockings began last week in streams and lakes all across West Virginia. Tomorrow, we're going to do a ceremonial kickoff of our fall stocking at an event in Wyoming County, and I'm going to get to enjoy a little bit of fun, you know, there for a few minutes and everything. But the biggest thing is just this, and I want you to take notice because, you know, I had a great friend and somebody that was a mentor, people we really looked up to in the community. He was our family doctor. He was Dr. Everett Ray. And Dr. Ray served at one time on the Raleigh County Board of Education, and what a stellar gentleman. He loved to bird hunt, and he loved to fly fish for trout and everything, and he loved the outdoors beyond belief. Now, he was a fabulous golfer as well as his son, you know, Everett Jr., you know, the same way, and Everett Jr. has been a doctor in West Virginia and in the Huntington area for a long, long, long time. And Dr. Ray and I bird hunted together more than you can imagine. And I can tell you, this man, you know, I tell you neat things from time to time about great West Virginians, but Dr. Ray used to tell me all the time, he'd say, you see that sunrise? Don't forget it. Don't forget how beautiful things like that are around you. Or he'd say, you know, you see that little bluebird, you know, and you'd take just a second to really see the beauty that this great state abounds in all over the place. The beauty that God above has given us and bestowed upon us. You know, I would tell you to take time, because as this cold weather comes and everything, the flowers around this great capital won't be as pretty as they are right now for very long. Take time to pause and just look and see how beautiful this incredible capital is in this incredible state. But then also right now, you know, last couple of days, you know, I've had the opportunity to be out in different areas of our state and everything. And I can tell you without any question, God's showing off right now. He really, truly is. And you should absolutely get out there and look at what the paintings are that he's making right now. It's unbelievable. It is truly, truly unbelievable. I mean, this state abounds in beauty beyond all comprehension. And that, in my opinion, wholeheartedly comes from God above. And so, as he's painting this picture, don't let it go by. Don't let it go by without seeing it. And then remember, just remember how beautiful it truly is. That's all I got right now.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good morning. As the governor said, the FDA and the CDC both came out with recommendations that we can mix and match vaccines now. So for people that have gotten their second dose of Pfizer or Moderna greater than 6 months ago, who fit within an eligibility criteria, and based on those criteria, we believe that every West Virginian 18 and older can fit into one such criteria, can choose to get either a third dose, a booster dose of the same vaccine, or an alternative vaccine. That is all approved under the emergency use authorization by both FDA and CDC. For people that got the Johnson & Johnson vaccine, that's 2 months after the dose of Johnson & Johnson that people should consider getting a boost, and that boost can be either with Moderna, Pfizer, or could be with Johnson & Johnson. Importantly, today, the FDA is now having a debate about granting a new authorization to immunize children 5 to 11 years old. As we talked about before, the data from the Pfizer trial showed a 90.2% beneficial reduction in symptomatic infection in those children that were vaccinated. And remember, this vaccine is a third of the dose of the vaccine we use in children 12 and over. Peter Marks, who runs the subcommittee of the FDA that starts to make this guidance, pointed out that 1.9 million cases have been seen in children 5 to 11 years old, 8,300 hospitalizations, a third of those in the ICU, 2,500 cases of multi-system inflammatory disorder, and 100 deaths in children 5 to 11 from COVID-19, making COVID-19 one of the 10 top causes of death in that age group. So this is an important debate and consideration to advance even further the ability for us to protect Americans and children in this case. And as we talked about a couple of press briefs ago, there is data now that children can be as easily infected, and transmit COVID-19 as adults, but are much more likely to be asymptomatic. So immunizing children, and this is a parent's decision, if this is approved for authorization, it would be just the Pfizer vaccine to begin with, will enable us to have a way to protect these children from severe infection that we just talked about, but also to try to also reduce transmission, because we really want to see the spread of COVID-19 reduce. The governor also talked in his opening remarks about the benefit of boosters. And let's just remind everybody of what happened in Israel. So in Israel, they at one point saw 68% of their hospitalized people be vaccine breakthrough cases. And that was because they immunized all of their population with Pfizer. And they were one of the first places in the world to immunize their population. And as they did the boosters in all of their citizens, they boosted 12 and over in their population. They saw after about 10 to 13 days, a marked reduction in severe cases, and they saw marked reduction in vaccine breakthroughs. And now over 70% of their hospitalized people are unvaccinated. So boosters work really well. And as the governor said, really important for us to target people that are eligible for the boosters to please go get your booster shot. And with that recognition, we know that the 8% or so of people who have died in West Virginia since vaccines have become available, who have been fully vaccinated, 92% of those people are over 60 years old, and 97% of those people are over 50 years old. So same age groups that we saw before who are at risk for severe consequences and death from COVID-19 now are in that group that may have been vaccinated a long time ago. So please go get your boosters, and very, very much emphasis on our group of West Virginians that are over 50 years old, over 60 years old and beyond. Really important to get your boosters. So much going on. If the FDA gives approval, the CDC group will meet next Tuesday, and we may be able to start offering vaccines to West Virginians 5 to 11 as soon as November 3rd, depending on how the assessment and the eligibility criteria get defined by the FDA and CDC. Thank you.
All right, thank you, Dr. Marsh. Next to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good afternoon. Updates on several different fronts. Antibodies. We continue to receive enough antibody IV doses. We do, for the first time this week, have a slight extra supply of the Regeneron antibody shot, but we continue to see supply chain issues with antibodies nationally. Vaccines. Saturday started the nursing home vaccination process for the Moderna booster for those individuals in those facilities. We will give you a more detailed update on this Friday's press brief as to the status, but all indications from the nursing home facilities is that is all going well and all going effectively and efficiently. This week, we are not receiving any shipment of Pfizer adult doses as Pfizer retools their operations and makes sure that they get the appropriate doses out for the 5 to 11 group. We have been able to order centrally 50,000 doses of the doses for children, and our retail facilities are now able to request doses as well. So we believe we will have plenty of doses available for those children that need to get vaccinated. As the governor pointed out, we continue to make slow but steady progress in our vaccination rates. As he pointed out, still in the age 65 and above, we continue to do exceptionally well. 50 and above continues to trend pretty well. But as the governor pointed out, it is slow and steady, and we need to continue to pick up the pace. Related to that, as the governor points out, facts and data are important. 92% of the people who in West Virginia who have died since we began vaccination in the United States 92% of the West Virginians who have died are unvaccinated West Virginians. That is the fact. That is the number that's out there. We continue to see a plateauing right now, as the governor pointed out, of hospitalizations. But what we are also seeing is, while we see a plateau and numbers start to decline overall in hospitalizations, since the last surge, ICU patients and ventilator patients are a much greater percentage of those patients in the hospital. And right now, we continue to see an uptick in ICU and ventilator patients. I bring all this information to you to point out that, as governors used in the past, the example at West Virginia University, 92% of the faculty and 81% of the students are vaccinated. And so far this year, even with interaction in the communities and within the college community, we have had a successful year, and we have not had significant health challenges among those students. In addition to that, as we've pointed out, with winter coming, we can potentially see another surge. And I bring all this to your attention to reinforce what the governor says. Numbers don't lie, and the data doesn't lie. And what we are concerned about, if we don't continue to get an uptake quickly in the number of West Virginians vaccinated, unvaccinated West Virginians and older West Virginians who don't get the appropriate booster dose are going to pay the price for what we see coming forward as we continue to go through and navigate this pandemic. Thank you.
Thank you, sir. Next is Secretary Bill Crouch with the DHHR.
Good afternoon, everyone. As the governor mentioned earlier, we had a question last week regarding the average age of deaths due to COVID-19. That was from Mark Curtis. Mark, we appreciate the question. Today, we added the page, as the governor said, to the COVID-19 dashboard that displays that average age of death by month. To find that information, you have to go to the dashboard, www.coronavirus.wv.gov, and select the other trend, which is towards the right next to the last. Click on that and then select case and lab trends. In the middle of the graph for deaths, there is a gold box that says click here to view the average deaths. That's where that graph is. It seems a little hidden. Again, our dashboard folks have done just a terrific job. Real estate gets a little tough to find to put additional information on here, but we're also adding, the governor mentioned on Friday, the average age of 74 deaths. That's the cumulative age of deaths since this pandemic started. So we're adding that to the graph. You may see that later this afternoon or tomorrow to provide a cumulative death rate as well. I want to thank everyone. The information we get from reporters and from the public is very beneficial to us. Many of the changes to the dashboard are directly a result of individuals asking questions and wanting more information. So we thank you for that and for that input. I also want to take a minute to recognize an individual in DHHR and the Bureau of Public Health that's retiring this week. Walt Ivey is a deputy commissioner, has been with DHHR's Bureau of Public Health since 1999 and became deputy commissioner for health protection in 2018. I can't begin to list all of the things Walt has done for the Bureau, but his leadership has been instrumental in responses to the 2014 Elk River chemical spill, the 2016 flooding, and has been an integral part of the COVID-19 response. So sad to see Walt go, but I wish him well and congratulations on retirement and good luck, Walt. Thank you.
All right, thank you, sir. Dr. Ainamjad, our state health officer, is also joining us today and is available for questions. We'll now go to questions from members of the media. The first today from Kenny Bass with WCHS and Fox 11.
Hi, thank you for taking my question. Sorry, the microphone was muted for a moment. This is for Dr. Marsh and for maybe General Hoyer. I know that you are loath to predict when the CDC and the FDA are going to do something, but do you have an idea for when that 5 to 11-year-old group may be approved for that vaccine? And General Hoyer, I know you mentioned that we've purchased doses and that retail now can get their hands on those doses, but how quickly could we react? Say the FDA or the CDC approves it Friday. Could we start giving out doses Friday or Saturday, or would that be a Monday or Tuesday or Wednesday thing? How many days would we be following from that approval till we can actually get shots in arms? Thank you very much.
General, you go, and then Dr. Marsh, please.
Yes, sir, Governor. So, Kenny, as it relates to how quickly, everything is prepared and ready to go. From our pediatricians to our clinics, all the folks are ready. So it would be the same as happened with the nursing home doses and the nursing home booster. As soon as the approval is granted, there will be folks who will get them, potentially young people who will potentially get them that evening. But if it's approved Friday evening, Saturday morning, for sure, doses would start going in arms, but some doses would probably even go in arms that evening. I'll turn it to Clay for the rest of the question.
Thanks, Jim, and thank you, Kenny. So the FDA needs to make their guidance, which should happen later today. Then the CDC Advisory Committee meets on November 2nd. They would have to also approve it and specify any additional indications that they would have. So presumably November 3rd would be the first date to be able to deliver vaccines. Thank you.
All right, thank you, Mark. Or I'm sorry, thank you, Kenny. Next, we'll go to Mark Curtis with Nexstar Media. Mark, it appears that we may have an audio issue. Do you mind to start again? Thank you.
Yeah, I'm here. Are you hearing me okay now, guys?
We got you now, yes.
All right. This is a question regarding churches, and it's been particularly one my church in St. Albans has wrestled with, is when are the guidance was no singing out loud, spaced 6 feet apart or every other pew. People are wearing masks is optional in our church, but people are wondering when, and I ask this because we only have one church outbreak in the entire state, but when will it be safe for people to be able to have community singing in church, community praying, where they're not just reading along with the words in the bulletin, they're actually speaking them out loud? And by extension of that, I assume the Mountaineers win Saturday, people are going to want to sing Country Roads in the stadium. When is it okay to have corporate singing and praying?
Mark, I'm going to defer to Dr. Marsh in this regard. He's always going to be cautious, but I was awful proud to hear him singing. Were you not? So and I think outdoors, I think we're good to go. But Dr. Marsh, maybe you can, I think we've always got to, and let me just answer this little bit, but we've always got to be aware of just this. I mean, when you really feel uneasy about a situation, you ought to try to get out of that situation if you can. And really and truly, if you're in a situation that people are jammed in there pretty close together and they're singing or whatever like that, may not be exactly the thing to do. But Dr. Marsh, go ahead.
Well, thank you, Governor, and thank you, Mark. I think the governor's really hit it spot on. So we know that everything that we do and sanction really becomes a risk-benefit analysis. And certainly churches are places of holy worship. And so we celebrate the ability for all of us to follow our faith freely and with our community. Yet at the same time, we do know that indoor situations with elders who are at higher risk of developing severe consequences of COVID-19 and singing and close community connections are those areas that might be at higher risk for some people. So, certainly we trust it to the guidance of the of the church officials and the congregation to try to understand what level of risk that the congregation is willing to take and what level it isn't. And I think that being careful is worthy for this kind of an environment, particularly with elders there. The governor's right. If you don't feel comfortable there, please don't go and try to tune in some other portal. Perhaps it's broadcast or there are other ways that you can celebrate. When we look at outdoor versus indoor celebrations, we do know absolutely that outdoor is much, much safer than indoor because of the dispersion of droplets and aerosols in the air, which cause that dispersion much quicker. So the droplets and aerosols don't gather. The other thing is for any indoor environment, we also are very focused on airflow. And so making sure that if you do have people in close proximity, then having air movement in the building, if you can open windows or if you can open doors or whatever, that does help as well. So I hope that helps.
Hey, just one second. Let me make this really, really, really simple. It just stands to reason that, in our churches, we have a lot of elderly people that Dr. Marsh just spoke of. And it also stands to reason from mathematically, you can see this and see it loud and clear, that if you're 65 and above and you get this, you're in real trouble, real trouble. And the death rate is really high. And so from the standpoint of you being there and others gathering around and singing at in a relatively closed-in atmosphere, it's dangerous. It really, truly is. We're not out of the woods yet. Now, I'd love to be able to sit here and say to you, if you're fully vaccinated, that's one level. If you're fully vaccinated and you've got your booster shot, you're a lot safer. Are you 100% safe? Well, of course not. We're not out of the woods yet. We're getting really close. We're really getting close, or at least we think and we hope and we pray we are. But it's just a matter of just exactly what I'm saying. It's just common sense. That's all there is to it. If you're over 65 and you're in a really, really crowded place and absolutely you're not fully vaccinated, well, you're cocking a gun at your head. That's all there is to it. And it's just not smart. So with all of that, if you're fully vaccinated and you've got your booster shot and people are halfway spread out and everything, then we hope you celebrate and in prayer and singing in the very best way. But just use really, really, really common sense and you'll be okay.
All right, thank you, Mark. Next, we'll go to Mark Cram with WDVM.
Good afternoon. Good to see all of you. And I just wanted to mention that a couple of things came to my attention recently. One is the personal commitment and dedication that each of you individually and collectively are showing in this fight against this virus, and really how we really owe a lot of thanks to you for that. And that extends to the healthcare workers in general in the whole state. And we just appreciate that so much. Second thing came to my attention was that the typical test result turnaround time is running, I'm being told, about 5 to 7 days. Could it be beneficial if that turnaround time was just a little shorter than 5 to 7 days? And thank you so much again for all you're doing.
I think, General, you've got to answer this, please. And thank you, Mark. I mean, really and true, you've been a real stellar, wonderful gentleman through all this and everything. And thanks, it's good to see you back on here from the Eastern Panhandle. That's for sure.
Yes, sir, Governor. And Mark, I'm glad you're doing well and recovering. And I think that to answer the last part of the question, clearly, the quicker the test result, the more beneficial it is. I don't have the current numbers. Maybe Dr. Amjad might have what our current turnaround times are, but If we're averaging 5 to 7, then clearly we need to improve upon that, because it doesn't provide us as much benefit. Fine.
Sure, Jim. No, you're right, but our numbers are normally 2 to 3 days, Mark. So I'm not sure which labs you're having those numbers from, but our average turnaround times are usually 2 to 3 days max, are the numbers we get from our team. So we're happy to talk to you offline, but our 5 days sounds too long. So I'm not sure which labs you're referring to or what numbers you're getting, but we're happy to talk to you offline. But we usually have 2 to 3 days max turnaround time. Even that's really long. That's our average for a long lab time, but happy to talk to you afterwards as well. Thanks.
All right, thank you, Mark. Next to Lindsay Renner Wood with the Cumberland News Times.
Thank you very much. This is Lindsay Renner Wood with the Cumberland Times News. Governor Justice, to switch up a little bit, I'm curious about your reaction to the Maryland elected officials who visited West Virginia recently, walking back effectively their interest in seceding from Maryland and joining West Virginia. I'm also wondering if you're still planning to try and convene a special session now that these elected officials from Maryland have effectively expressed that it's dead in the water. Thank you very much.
I didn't get the last thing you said. Did you say these officials have now, expressed that this is dead in the water? Did you say that?
Yes, sir, I did.
And what officials are you referring to? Are you referring to the governor in that, or the local folks?
I'm referring to the local elected officials, sir. Delegate Buckle has walked back his role in a letter to other elected officials. That's the first example that comes to mind. Okay, well, let me just say, from West Virginia's standpoint, I think without any question that West Virginia, over the last few years especially, has made incredible strides forward. That's all there is to it. I mean, with what we've done as far as commitment to our teachers and roads and tourism and diversification and our rainy day fund and the stability of this state, it's really good. I mean, there's no question it can be better. We continue to try to make it better. We just went out and announced $1 billion broadband plan. There's so many different things that are going on within West Virginia. The lowest in history. Our unemployment rate. How we've handled the pandemic and got us through all this, and we're proud of our natural resources. We're proud of our diversification. We're proud of all the great stuff that's going on in West Virginia. Now, with that being said, from folks that are on the borders of West Virginia, well, please explain to me, why wouldn't you want to come to West Virginia? I mean, please, somebody tell me, why in the world, if you had any choice under the sun to stay in Maryland or join West Virginia and what's going on today, well, it would take a dumb bunny to absolutely not want to come to West Virginia. Now, from that standpoint, how would West Virginia respond? West Virginia would respond just straight up. And they'd say, we stand here with open arms to welcome all. That's all there is to it. Now, do we want to get in a food fight with Maryland, trying to take counties away from Maryland? No way. Is it a real uphill battle to be able to pull this off? Well, sure it is. But with all that, these 3 counties, especially in Maryland, they don't see probably eye to eye with what's going on in the State House and everywhere else all across Maryland today. They don't see eye to eye with that at all. They're much more in tune with where we are in West Virginia, where we stand, for the Second Amendment. We stand strongly behind the right to life and all the different things that we stand for in West Virginia. But with all of that, we would welcome, not only would we welcome the folks from Maryland, we would welcome folks from all across this globe to West Virginia to join in what's going on here. Goodness, surpluses, not deficits, absolutely goodness that's going on. Beauty beyond belief, beyond belief. The 4 greatest seasons, the best people under the sun, absolutely people that know how to love and appreciate others, people that really know the difference between right and wrong, and people that are real craftsmen. The absolutely best people on the planet are right here in West Virginia today. And they welcome and they love people from all across the globe, from every walk of life. And absolutely, with all of that, all I can say is just this. We're not going out and beating the drum trying to get counties to move here from Maryland, but at the same time, if they come asking and they want to join West Virginia, absolutely, the first step is, would we welcome them? Absolutely, hands down. We would take them in a millisecond. And then from the standpoint is, does Maryland really think that they're totally out of tune with the way Maryland folks are really thinking and everything? And if they would want to get rid of them, well, they've got a great place to come to. I'll promise you that. But beyond that, we all know it's a great big uphill climb and everything. And I surely can't address or help, from the standpoint of the local, officials that came and really felt like they're representing their folks, and then now all of a sudden they switch channels and go another way. Well, to me, that's just nothing but politics. And if they want a place here today where people are doing the right things, irregardless of politics, the right things, whether you're a Republican or a Democrat or an independent, we're doing the right things in West Virginia. But no, we'd welcome you. We're looking for you to sign up and come on down.
All right, thank you, Lindsay. Next to Paul Mullen with WCBC.
Thank you. And Governor, I'm going to follow up on Lindsay's question a little bit. When does your office or you personally get involved in the discussions between the local delegation from the 3 counties and the people in West Virginia? Is that all done at the legislative level? Did you have any heads up that this letter was coming? How did it all work from your office and your perspective? Were you shocked when the letter showed up, or did you know something was coming? Thank you.
I really wasn't shocked. I mean, we knew the letter was coming before it arrived, but with all that, I think the discussion, started on the legislative level, which is right, and as this goes forward, if from our standpoint, in the state of West Virginia, if it goes forward and the folks from those counties decide, no, they really don't want to do this or whatever it may be, that's fine. That's absolutely fine. I know there's a bunch of people there that would love to migrate to West Virginia, and they can come. We'd be tickled to death for them to come, and there's great job opportunities, and they have an opportunity to have a job that's phenomenal and grow within that job and everything. But they also, while they're doing that, they live in paradise. That's all there is to it. All you got to do is look out the window and see what's going on. But I think the process is going the correct way. I think first of all, the interaction needs to be with the legislature. I need to be the first, the forefront of the whole thing from the standpoint of knowing what's going on and absolutely opening our arms and welcoming. But I think the process is going all the right way right now. And we'll see. We will see. And like I said, it's a great big uphill climb and everything. But I don't mean this in a bad way, but all you got to do is just step back and look at what's going on in D.C. And if your government is in tune with that, I'd really want to leave. And if there is a way to leave, I'd really try hard to leave.
All right, thank you, Paul. Next, we'll go to John Mark Shaver with West Virginia News.
Good afternoon, everybody. I'd like to circle back to the vaccines for the 5 to 12-year-olds. Does the state have any plans to address any potential hesitancy from parents or guardians who may not want to get their children that vaccine?
Okay, Dr. Amjad, maybe you can do this one.
Yes, Governor. John, with any vaccine, we hope that parents of patients get the proper information. We do understand that because the vaccines are fairly new, that maybe a lot of parents have a lot of questions. So we do have the vaccines available to pediatricians, local health departments, community health centers. So I think when parents can go to their own pediatricians, their own doctors, they can ask the proper questions, get proper information. And I do think with given time and proper questioning that parents can get that information for their children. As a provider myself, I think when you can sit down and talk to parents and answer questions properly, even if they don't want the vaccine right away, given some time that they might want it. So we're out there, giving proper information, messaging it in a way that people can understand it. And I think that's going to help a lot of parents who might have a lot of questions. So I think that's the best way to approach it right now. Thanks.
All right, thank you, John. Governor, I'll turn it back to you.
Well, I really, the notes that I've made today, I listened to all, that's for sure. General Hoyer had to step out, and he had another commitment and everything, and so I'm gonna brag on him a lot while he's gone. But I wrote down a lot of stuff, that he said, when he said, we've got plenty now of the IV antibody. We don't, from the standpoint of other variations that we don't have quite as much as we'd like, but we're working it. He says Saturday we're going to start our nursing home booster shots for Moderna. He said that from Pfizer we're not going to receive adult doses this week and everything because they're kind of switching over to be ready to do the 5 to 11-year-olds. He also said that it is an absolute fact in West Virginia that 92% of the deaths have come from people that were unvaccinated. I think that's absolutely important. But then he said this, and this is a heck of an accomplishment, and I hope I got this right. But he said that 92% of the faculty at WVU were vaccinated. And he also said that 81% of the student body is vaccinated. I think that's the numbers he said. And really he said, and for the most part, West Virginia is having a good year. Now, West Virginia University, it's a heck of an accomplishment when you really think about it. They have actively worked very, very hard to get their numbers way up, and those kids and the faculty and everything, that university is enjoying a good year, according to him. Well, in a time when it could surely have been looking at not so good stuff. So I really think that absolutely there's words of wisdom from all the experts that we have, whether it be Dr. Marsh or Dr. Amjad or Secretary Crouch or General Hoyer, and hopefully from time to time from me, but the people that we have and absolutely we draw wisdom from every day. I appreciate Mark's comment and all the comments, that from the standpoint of asking about, the age and how the average age of the folks we're losing has dropped dramatically. But with all of that, I would just say just one thing. Remember what I've said, and I've stood steadfast by this. We have stayed together. We have stayed together the whole way. West Virginians have surely had different views, but we have always continued to pull the rope together in this pandemic. We're getting through it. We should absolutely be respectful of freedoms. We should be respectful of others in every way. Every way, if they decide not to be vaccinated or whatever it may be, we should be respectful of those freedoms because they have made us what we are today. We'll get through this. We'll get through this as long as we continue to love one another and support West Virginians and support our effort in every way. God bless each and every one of you. I'm really proud of you. And thank you, General Hoyer, for all this great stuff too. Thank y'all.